Hey guys, welcome back to the channel. Today we have another practicing genetic counselor interview. This is with Andrew McCarty. He has some very interesting stuff to say because he also, aside from just being a practicing genetic counselor in kind of an industry setting, he also does some freelance work slash kind of private practice. It's called Clover Genetics. You'll hear him talk about it in this video. So that's a really interesting new insight we have, and I hope you enjoy it.
All right, so to start off, would you mind just giving a brief introduction of yourself?
Sure. So my name's Andy. I'm a genetic counselor by training. I've been a genetic counselor since 2015, so about 6 years. I have a pretty varied background. I used to work in clinical practice over at the Children's Hospital of Pittsburgh. In the past 2 years, I've transitioned over to working at PerkinElmer Genomics, which is a genetic testing lab. My interests in genetics are likely equally as broad, kind of focused in like neuromuscular disease, but I also have an interest in psychiatric genetics as well. So yeah, that's a little bit about me. I'm happy to go into whatever details, but we'll leave it there.
Yeah, that's great. Thank you. One of my first questions for you is, would you mind explaining to me some about the Clover Genetics that you've started? Because that's definitely a very unique thing I've seen from you, and I'm curious what it's all about.
Sure, yeah. So after I left Children's Hospital of Pittsburgh, I, really wanted to stay in clinical practice, but wasn't sure how to do that effectively. I recognize that there's, I think with genetics in general, there's an issue with access to genetic services. And I've always been interested in like telehealth and like the technology side of things. So all of that kind of culminated in deciding, I really wanted to get back into clinical practice. That was the most effective way to do it. So I started Clover Genetics unofficially a couple of years back, but officially probably end of 2019, not knowing what was right around the bend there, which worked out for telehealth. But yeah, from there, I've kind of developed that out over time, focusing on, again, neurogenetics for the most part, but we see all sorts of different specialties there. And I've worked with a couple of different interns of folks interested in genetics to help kind of build up some processes there. But yeah, I'm happy to kind of go into whatever aspect you want to talk about that.
Yeah, sure. So would you classify that as your own practice, basically?
Yeah. So it's basically my own private practice. It's not something I completely do full time, given my job at the lab. But hours in the evening, I'll focus on that for a couple of hours and see some patients there. And we brought on another genetic counselor, actually graduated from Pitt.
Oh wow!
The past month or so. So we're hoping to expand a little bit there. But yeah, I would definitely classify it under private practice.
Okay, that's really exciting. I know that's something that at first when I learned about genetic counseling, I didn't even realize you could make your own practice out of that. I thought it was more of just a hospital setting or something like that, but that's definitely something that I have been interested in as well. It's a very cool opportunity to take advantage of.
Yeah. And I think that's one of the things that is tough about like private practice for genetic counselors is there's a whole like background in terms of, laws and policies. So at like the federal level, Medicare, for instance, genetic counselors actually aren't recognized as healthcare providers, which is something a lot of like folks in the NSGC are working to push for. But that means, in terms of reimbursement, it is very challenging, for Medicare because Medicare kind of leads the decisions to a certain degree for like private insurers and how much they'll reimburse and things like that. So there's like a lot of barriers in terms of cost effectiveness at a broad level, which is why I've kept things small because it's self-pay can be challenging for some folks and things like that. So there's like a lot of aspects there in terms of licensure that probably make it less attractive to get into that space, which I think is why there's not as many GCs that actually do that.
That definitely makes sense. It seems like it'd be an uphill battle, but it's good to see that people, especially even in the NSGC, are pushing for that. So hopefully over the next couple of years, it starts to get better each year with the way that that's recognized.
Yeah, that's the hope.
Yeah. And so I know you mentioned to me before when I was reaching out to you about a some kind of mentorship for prospective students? Is that what you would include with the interns you have at your company there? Or is
So
that
it's
different?
a little bit separate. So,
Okay.
you know, I had kind of, when we were starting out, just trying to get some folks who are interested in genetics and interested in kind of developing out the operational aspects, and kind of learning about genetics along the way. Whereas the mentorship program is a little bit more focused on, you know, getting accepted into a GC program and, you know, building up your resume appropriately, connecting with genetic counselors, both in terms of doing you know, informational interviews as well as shadowing to get that experience, and just all the other professional development that it's, you know, as I'm sure you're aware, a highly competitive education program to get into. So, you know, just trying to help folks there and understand, okay, this is what I need to focus on, and things of that nature. And the hope is, so I just started it, I believe earlier this year. The hope is really, you know, over time that, you know, some of these people that I'm mentoring, I continue to mentor after they ideally get into school and graduate, and really you know, build those types of meaningful relationships and do that. So yeah, I've always been interested in kind of working with students and other folks, and kind of, you know, passing on knowledge and all of that. It's enjoyable.
That's awesome. It's definitely really helpful, especially in a field that's so small where it can be hard to get some exposure. But how would someone get into that if they were looking to get some mentorship?
Oh, so we have a link on the website, so someone can kind of look there. Usually we ask for like a resume and a statement of interest, and then we'll kind of chat one-on-one to see you know, what their interests are, what their timeline is, and things of that nature, to see if it would be a good fit, and kind of just move forward from there.
Okay, great. Thank you. So another question I have for you is, in terms of the specialties you've gravitated towards in your career, what would you say led you to go the direction you ended up going?
It's a good question. So I would say, you know, starting out, just a little bit of history of my family. So my initial interest in genetics came from, you know, actually having genetic testing. So I believe I was in like 6th or 7th grade, and newborn screening had just started for a certain number of conditions. You know, my youngest brother had just been born, and he screened positive for this one condition. So then we had to have genetic testing, the whole process. And it was right when we were doing Punnett squares, and it's a biochemical condition. So, you know, I was always interested in it at that point, but didn't know about genetic counseling until, you know, really actually graduated undergraduate, and worked at the Children's Hospital, and, you know, kind of shadowed a few GCs there, and really got interested in it. So, you know, that was my first interest, is, you know, more in the, you know, biochemical genetics for a certain degree. But then after I graduated and went to, you know, Children's Hospital Pittsburgh as a genetic counselor, it kind of just happened that there was a vacancy in the neuromuscular department. So kind of by necessity, they put me in there. But then, you know, just working with the patient population, I really came to, you know, really enjoy working with the families, and just because it was a multidisciplinary clinic. So they'd have like a genetic counselor, but they'd also have like neurologists who specialized in neuromuscular conditions. They'd have like PT, OT, all these other support services. There was a foundation that also would pop in from time to time, make sure they have like resources there. There were certain camps and things. So it's really cool to just like meet individuals over time and get to know them. And, you know, I just really enjoyed that. So that's kind of how my interest of neurogenetics and neuromuscular disease kind of started.
That's so great. It's nice that it worked out kind of as necessity at first, but it seems like something you really enjoy now.
Mm-hmm.
So on that note, what would a typical day in your career kind of look like for you?
Oh gosh, so it's changed over the past like 6 years in terms of like what I do now versus what I did when I was just in clinical practice. So if it'd be helpful, I can kind of talk about like both of those, if that would help.
Yeah, absolutely.
Cool. So currently, you know, usually the days are a little relatively structured, but I wear a bunch of different hats. So One of my roles is leading the client service department at PerkinElmer. So we have a team of GC assistants and client service reps that take all our incoming calls and emails from physicians, genetic counselors, sometimes patients call in as well. And they'll answer most of the questions, but at times we'll get more complex questions in terms of like technical aspects of a test or understanding, okay, this result, got this result, what does it mean? How do I talk to a patient about it? And that's kind of my role, is jumping in there to walk through that. So that's a big chunk of my day is supporting that team. But then also we have a lot of different test development that we do, business development. So working with like different pharmaceutical companies or foundations that want to offer genetic testing to either obtain that data or somehow use that data for research and development, or getting a certain drug or something to a patient population. So building out and like starting those programs is a lot of work. So we genetic counselors typically work as like the subject expert to a certain degree on like the genetic testing, the genetic counseling, and understanding what the implications of that are. So another chunk of my day I'll typically be involved with that. And then, we're kind of a newer lab, so we're still working out a lot of our processes and how to best handle all the sample volume we get and the issues that are on there. So just a lot of problem solving in a lot of different ways. But the theme is always genetics, but it's I'm always working with like a lot of different people. And PerkinElmer is actually an international lab, so I get to work with like folks in India, China, and all over the place. So that's kind of the daytime. And then, as a couple of days of the week, I'll slot some hours at the end of the day for Clover Genetics. And that kind of is just meeting with patients, face to face, and providing genetic counseling. So making sure that they understand the test, coordinating the testing as well, and then obviously explaining the results to them and supporting them through that whole process. And then, it's also just kind of running Clover Genetics. So there's all the stuff with a small business of, accounting, malpractice insurance, website, social media, all that fun stuff. So yeah, that's kind of a day in the life. And then, whatever free time, I'll do other stuff other than genetic counseling.
That's awesome. I guess a question I have about that specifically is, would you classify your role at PerkinElmer as like an industrial genetic counselor? Is that what it is? Or would it be more of a lab genetic counseling position?
Labels are tough. I mean, yeah, it's like, I guess you would call it an industry job, whereas like you have like clinical and industry, but there's like so many different, I think that's like, doesn't do the title justice, because like you could have a genetic counselor who's an industry who does like totally just marketing. Like we have a marketing team that's like 3 genetic counselors, or we have like people who just do variant analysis, or like me, where it's like a little bit of operational and lab stuff. And then we've got like folks at the director level who, just kind of, I don't know everything they do, but they, direct a lot of the different programs, make the decisions there. So yeah, industry would be the best way to put it, but I think there's a lot of different things you can do under that umbrella of industry. It's not just like lab genetic counselor.
Mm-hmm. Okay, that's why I was curious, because it definitely seems like there is so much variety and flexibility with what you can take on that it's certainly hard to put a label on it. But I'm trying to definitely understand the different routes you can take with the specialties you pursue in your career.
Oh yeah, there's definitely I think at least right now, there's like genetics is just exploding so much, and there's just so many different areas where we need folks that have that like ability to interpret all this complex information and make it understandable for everyone.
Absolutely. You just reminded me with that last response, in terms of the teams you've been able to work on with your different careers and your different groups, can you speak at all to the role you fill as a genetics expert on those teams? Because as I understand it, there have been, as a genetic counselor, you have the opportunity to, even on a team of medical doctors, still serve as a respected expert on just your genetic knowledge. So can you speak to that at all? Have you had those experiences?
Yeah, definitely, and especially like early on in my career, and they still kind of feel weird to me because you have, this like concept in your head of like doctors gone to school for, it feels like a decade or something, and they're like the experts, and then they're asking you as, this new graduate out of a master's program, and sure, it's a rigorous program and you learn a lot, but still it's this weird imposter syndrome kind of deal of like, oh, they're asking me all these questions. But I think it's great that there certainly are physicians who don't have that level of respect, and I'm not saying that's a majority or anything, but I've had scenarios like that. But also on the other end, I think the majority have been asking for that type of input, and it's it's great because there's a lot to consider in terms of it's not just the results, but it's the impact of those results, like the psychosocial piece, and those are the pieces you kind of bring in as a genetic counselor, as well as just the implications of truly how do you get testing out to all these folks, and what does that testing mean, who does that impact in the family. So really trying to take that like broader view is I find is where the genetic counselor tends to come into those conversations, but they're all very different. And it depends on if you're working with other healthcare providers or if you're working with like business folks. They may have a completely different lens that they're looking at things through. So in those, it's really important to say like, hey, hold on, what about these variants of uncertain significance? Like, what is the impact of that to like, how do we reduce the risk for people to misinterpret their information? So it's really broad.
Okay, that was super helpful. That's definitely a really interesting dynamic, but I think that's one of the cool, unique things about this profession and specifically the education, like the master's degree that goes into it. Like you said, having just this condensed but very intense master's education, and then becoming essentially an expert in some teams is very cool.
Oh yeah.
So within the limits of patient privacy and everything, would you be able to tell me about a case that you've seen over your career that really stuck out to you, and maybe it was like a learning experience kind of situation that that helped you grow and that like really stood out to you as a special case?
That's a good question. So, gosh, I would say one that really stuck out to me, and I'm going to have to be very, very vague here. But I met with a patient, probably at the beginning of my career, and we saw them for one particular aspect of, I believe it was something early in life that you would see. And met with the family, took a family history, and it was pretty straightforward. It wasn't a diagnosis. Let's say it was just a carrier status for something. So, we do a lot of newborn screening and counseling on newborn screening. So it's very, I don't want to say any case is routine, but it felt very routine. It's like we take the family history. Hey, you're a carrier. This means like, this is the risk in the future. If you have any other kids, this is the information to know, and kind of took a family history. Nothing was like jumping out to me. And then, so fast forward 3 years, and then I have the same patient actually come back in the door, and they actually had a much more significant diagnosis. They now had been seen by neurology or something of that nature. And we really dug into their family history a bit more and found out there was similar findings in a cousin, as well as actually an aunt. And again, it's really important, I think, and was like a pivotal point to me of like really asking those in-depth questions and asking them in a way that you get the information you're looking for. Because if you just ask a very broad question, are there any health concerns, you may not get that type of information that actually is there. So I think the end result of that was we actually identified a diagnosis in this patient, as well as their cousin, aunt, and mom over time. But it just highlighted to me really the attention to detail of like needing to ask questions and understanding that there's a lot of subtlety in terms of like how you as the clinician approach a case, but also how the family sees where they are. So for instance, say if they are in pulmonology versus neurology, they may be thinking about completely different things as would the pulmonologist or the neurologist. So as the genetic counselor, really focusing on the big picture there, I think is really important, because even as, you know, someone who's focusing on the big picture, it can be really easy to miss those diagnoses.
Wow. So are you saying essentially that because of the kind of miscommunication there, or the difference in the lens that the patient and counselor were looking at, that's something that they might have been able to uncover in the initial meeting as opposed to
Yes.
years later?
Yeah, it's possible. Again, every case is different, and there's a lot of subtlety there. But yeah, it's something that could have been identified earlier, and perhaps early intervention or things of that nature. Thankfully, nothing catastrophic or negative did happen, but you know, it kind of highlights the need for that attention.
Yeah, it's definitely a very good lesson to learn from that. Thank you for that.
Mm-hmm.
I'm wondering if you can pinpoint what you might say is the most rewarding aspect of being a genetic counselor for you.
I would say probably just getting to work with people overall. Like I love getting to just hear people's stories and, like, you know, just see where they're coming from. If it's like in a clinical space, it's you know, certainly there are scenarios that don't have what you could typically call a good outcome, but being able to support families through that, I think, is rewarding regardless of the outcome. You know, you can give people closure and things of that nature. And on the flip side, in industry, it's, you know, there's a lot of a bit of an ability to work with a lot of different individuals from a lot of different backgrounds. And I kind of really enjoy being the expert in the room. Like genetics and such, I'm actually like a very quiet person outside of my professional space. Like I'm usually just a fly on the wall and don't say anything, but then you start talking about genetics or anything, and I just talk on it. So, you know, I think just being able to be the expert there and you know, just, yeah, listen to people and help them get to the outcome that they want is, you know, just something I really enjoy.
That's so great. I definitely know that's something that really excited me. I know it's a cliche of this field, or at least for prospective students, but you know, the combination of science and people and that whole thing. But it's definitely, I mean, it's not wrong, you know, to say that, but yeah. Definitely something I'm excited for as well.
Oh yeah, everyone says that, but it's true. I mean, like most of it's just kind of in the name, genetics and counseling. Counseling is, you know, talking, and genetics is science. So it's bound to be the cliche.
Yeah, absolutely. And then I'm curious, on the flip side of that, if you could pinpoint maybe the most challenging part of being a genetic counselor.
Sure. So I think a couple of different challenges. I think in terms of clinical care, one of the biggest challenges is making sure that there could be challenging cases, I guess is what I'm trying to get at, in terms of like bad outcomes. Like not you're working with these devastating diagnoses. So, you know, understanding that and making sure that you're present for the family, but at the same time you maintain a good work-life balance, and compassion fatigue and, you know, things of that nature, and burnout are very real possibilities. So just you know, understanding the implications of the information you're sharing and making sure you are protective of your own mental health to a certain degree, I think can be challenging. You know, I think there's it's a balance. You know, I think that is one of the big challenges there, but there's certainly a balance. And then in terms of industry and even in a clinical space, especially when I was like new, because genetic counselors get this really broad training and everything, we can like fit into a lot of pieces of the puzzle, which is great for opportunity, but at the same time, it's really easy to not say no to anything, and then you're like overcommitted and you know, have to kind of step back there and be very careful about saying yes to things. So I think that's another challenge that I see kind of come up that's not specific to like clinical work.
All right, yeah, that's very interesting. I haven't really heard the sentiment of the second part of that with overcommitting yourself, but it definitely makes sense. I can see how that could be a trap you might fall into at first.
Oh yeah, yeah. Especially as like you're a new grad and you want to like set. I don't know what the saying is. You want to like impress people, and
Hmm.
yeah, it's a slippery slope because if you do something
Yeah.
well, people are like, oh, let's go ask Andy, and then it just people keep asking.
Hmm. I guess my next question for you would be, in terms of someone in my position, if you can think back to when you were applying to graduate programs, um, what would be some tips you have? I guess there might be two different ways you're thinking about it. It's how I'm thinking about it personally, is whether it's just tips about application materials like interviewing or writing a personal statement or something like that, and then also just a general perspective or wisdom of maybe an attitude to carry into your application process.
Sure. So I think what's more important, because folks will pick up on this regardless, is the attitude you take into these applications. So I think a big piece and why all these schools push like informational interviews and shadowing is to truly understand what you're getting yourself into. Essentially, what is the breadth of the field, and make sure that that is something that you truly do have an interest in. So I think just understanding why you want to get into this field is really important, like at a core level, which I know requires a lot of like introspection and things of that nature. But like knowing that and having I think you can really apply this to anything in life that you want to do and want to do well, is to focus on, okay, why am I doing this? And then from there, everything becomes not easy, but a little easier to communicate. So in terms of like applications and any type of essay or personal statement that has to go in there, that gives you a base to work off of. And the same thing in terms of interviews, questions like that come up, and being able to answer that clearly and with passion for whatever the space is. Folks pick up on that. So I think that's a big piece there. And then there's the obvious things of like making sure you have all the prerequisites and in terms of GPA. And I don't think that's the only thing. But really, figuring out what your interest in there, I think can really help overall.
Okay, that's definitely great advice. I appreciate that. Definitely seems like having that genuine nature to all of your answers and all of your reasonings for going into this will definitely show through, whether you mean for it to or not. And I guess that's something that programs will really pick up on.
Yeah, I would hope at least.
Yeah. And last thing, kind of related to that as well, with the actual process of the graduate program, could you just speak a little bit to what led you to choose the program you chose and everything like that?
Sure. So I'll have to admit, I applied to quite a few programs, but frankly, Arcadia was the only one that accepted me. So that kind of made the decision a little bit easier. But yeah, my goal really was, I really wanted to get at a genetic counseling program, period. I knew I wanted to stay in the Northeast region, so I looked at kind of all the schools within that region and applied to all of those. I guess I don't have as much background in there because it was Arcadia offered me an interview, and that was the one school, so it made the decision a little easier than folks who had to choose, and this was before they set the match program into effect. So I can't speak to that too much, but that was kind of my experience.
Absolutely, yeah, I appreciate that. All right, well, again, I really do appreciate you taking the time today to speak with me. It's been very helpful, and yeah, I really appreciate it. I'll be in touch.
Yeah, awesome. Yeah, it was great getting to chat with you as well. Yeah, if you ever need any input on graduate school, genetic counseling, anything, feel free to reach out.
I appreciate it. Thank you. All right, have a great rest of your day.
Bye.
Bye.
All right, again, that was Andrew McCarty. I really hope you enjoyed that interview. I know I did. In addition to these video interviews, I'm probably going to put out some more content. One thing is that I've started reading the Guide to Genetic Counseling, which is one of the intro textbooks for a genetic counseling student. So just trying to learn some more about the field through that. And then in addition to that, the application cycle that I'm applying to is starting up very soon. So I might show some stuff through that process, such as like applying for the NMS match and some other application materials, just to help out anyone who's thinking about doing this in the future as well. So stay posted for those, and I'll see you next time.